Well, actually, we see quite a lot of nutritional deficiencies in people before bariatric surgery too. So we aim to fix those up before surgery. And then after surgery, we monitor a whole lot of nutritional parameters. But the main ones we generally see problems with would be calcium, vitamin D, vitamin B12, iron, and sometimes vitamin B1. Well, they're definitely going to need to be taking a nutritional supplement or a regime of nutritional supplementation, which we'll advise them on. After that, I can probably sum up what they need to do fairly well using the bariatric plate. So the first thing they need to do is watch their portion control, because the maximum we want them to eat is about a cupful of food at a time, which is the amount that would fill the base of this plate, 2 centimetres deep in the middle. They'll also need to think about the nutritional quality of what they eat. So making good food choices. For example, for this meal, I'd be encouraging half a plate of protein, so red meat, chicken, fish, egg, legumes, or tofu, and then half a plate of free vegetables, so broccoli, cauliflower, carrots, beans, zucchini, cabbage, all of those sorts of vegetables, and possibly a small amount of carbohydrate depending on the individual. Then there's a whole list of things that they need to think about while they're eating to get the best tolerance with their food, and that relates to the prompts that we've got around the plate border. So we've actually got a whole regime of tools to help the patients to get through any difficulties as they go through. So we've got recipes, we've got other portion size monitoring tools and snack guides, etc. Well, the role of the GP is actually really important, because you're probably going to persist in their life, whereas the bariatric team are kind of coming in initially and then we're available later on. But that first year they're pretty involved with us. So what I'd hope from the GP is to monitor their medical conditions, modify their medications as required, and then at the end of 12 months we'll give a pretty comprehensive report identifying what the patient's weight was at that 12-month mark, what would be a reasonable variation to expect in their weight, and what supplementation we've recommended, and what pathology to keep checking on each year. And then you'll know to when and why to refer back to us in the future.